Utah politics.
May is Mental Health Awareness Month, so this morning we're digging deeper into the resources and efforts to make a difference. For more on that, we welcome Taryn Hyatt. She is with the American Foundation for Suicide Prevention, and State Representative Steve Ellison to the show. Great to have both of you here for this important conversation. Thanks for being here.
Thanks for having us.
Let's start off with mental health in Utah, the state of mental health in Utah. Taryn, we'll begin with you. Paint the picture for us.
Yeah, you know, mental health problems are common. We know that 1 in 5 will experience a mental health condition in any given year, and half of the population, you know, will experience one in their lifetime. And we are in what's called a mental health crisis. We've seen that. We've had a lot of people really struggling, especially through the pandemic, and the need now is greater than ever to be connecting to support, to getting help, having affordable access to health care. And those are some issues that we're still struggling to meet, but definitely working hard to ensure that people have access.
Representative Ellison, you recently checked in with the CDC to see how things are going here. Give us a report on the latest information.
Yeah, so there is some good news. Utah has now had 4 years of back-to-back declining suicide rates. We know that this is a public health issue that is addressable. There's hope and there's healing, and getting the message out about what resources are available are critical. And while the national rates appear to be going up still, Utah's rates are going down. So we're very encouraged by some of the trends that we're seeing.
Taryn, I found your statistics interesting in that about half of the population may never experience anything like this.
Yeah.
For those who fit into that category, what is the most important thing for them to understand?
You know, the thing I love, and I love teaching this class called Mental Health First Aid, is again, it's very simple. We all need to be educated as family members and communities about how we can support somebody who's struggling with depression or anxiety, bipolar disorder. And really what we need to continue to do is recognize these illnesses sooner so that people get more effective treatment early on. Unfortunately, the stigma and sometimes just us not even understanding what's happening with us keeps us from getting the appropriate help. And so if we can encourage our community members to, again, get trained to understand what mental health can look like, especially when it's starting to decline, and again, be able to connect people to that immediate support, whether it's through peers or professional help. But getting help sooner, again, provides those great outcomes so that we don't see people ending up in crisis centers. And like Steve mentioned, you know, having that decline in our suicide rate shows that what we've been doing is working. Something
very interesting I've never picked up on, I just heard you say, is catching it early. We hear that with a lot of ailments that we deal with in society.
Yeah, you know, it's research has shown that most people who experience a mental health condition have their first onset of symptoms around age 11. Yet, most wait almost 10 years before getting a proper diagnosis. So again, just like any other illness, if we recognize it early, start treatment early, our outcomes are so much better.
Representative, this is something that you have taken up as a cause in the state legislature, have run several bills on this issue. Talk about why.
Yeah, thank you. So about 12 years ago, shortly after I got elected, in my local school, there were several children who died by suicide, and I'd also lost some extended family members. And so not really knowing where to start, I started talking to people and got some ideas, and then so many of my colleagues just came out of the woodwork and expressed how they'd had issues in their own family or their own lives and wanted to know how they could help. Fast forward over a decade, with the legislature, we passed over 24 bills trying to improve mental health and resources in the state of Utah. And it's not just a bipartisan issue, this is a nonpartisan issue. Almost all the bills we pass are unanimous, and it's something that is just so essential to you know, moving our society forward. It's kind of, to me, the epitome of kind of life, liberty, and happiness.
Taryn, here we are. We have a month set aside specifically for awareness. Talk about a couple things for us. One, the importance of setting this month aside, and what is your organization's message this month?
Yeah, like any other health issue, we want to dedicate time to, again, educate our communities about it, get rid of the stigma, make sure people know where to get help and support, what resources are available when they are struggling. And AFSP decided this year to demand more. Welcome to my shirt, right? Demand more for mental health. You know, we need to demand more funding, and thankfully we have, you know, those champions in our legislature. Demand more access to affordable health care and services, really ensuring we have that school-based, you know, prevention and mental health messaging. And then again, just demanding that we have access, that our insurance covers it, you know, that parity is enforced when we go to seek these services.
Let's dig into some local resources that are available. Representative, you can lean on some of the legislation you've passed recently, but what are some of the most important things people need to know as far as what's available out there?
Yeah, there's a lot of great resources, Glenn. The Utah Crisis Line, 1-800-273-TALK, is available 24/7, 365. That's answered here locally. Anybody in crisis or feeling like they are moving towards crisis can call that number and speak to a professional mental health worker at no cost, confidentially and anonymously if they wish. The Utah the Utah Warm Line is another great resource that a lot of people don't know about. That's 1-833-SPEAK-UT, and that is staffed by peer mentors. So there are people who've had their own mental health challenges and are in recovery and doing well, and they can speak to somebody, again, at no cost and confidentially that knows, likely how they're feeling. And
I wanted to mention one other thing real quick. As you go around talking about this, you bring in an example of a tool that can help and is really important in this issue. Talk about that.
Yeah, so something a lot of people don't know is that there's one thing that parents could do, anybody can do, that could cut our suicide rate in half almost overnight. It only takes about 5 minutes, and it's the use of a very simple device. In this case, it's a trigger lock, and that's a way to properly secure a firearm when it's not in use. And the reality is that when people buy a firearm to protect themselves or their family, statistically, that gun will most likely be used, if it is used to injure or kill somebody, on their own family member by a family member. And so by taking just a couple minutes to install a trigger lock, or storing the ammunition and firearm separately, or even removing temporarily if that's what's needed, can go a long way towards saving a family member's life. Because for youth, that suicidal crisis is usually 10 minutes or less, and if they don't have access to a lethal mean like a firearm, they're going to live.
Taryn, anything else you would want to add on the topic of local resources?
Yeah, I would just promote our local NAMI Utah chapter. So the National Alliance on Mental Illness is having their walk coming up on May 21st at Veterans Memorial Park. Come out. NAMI has, again, peer support, like Steve mentioned, with the Warm Line. They have free family support groups in education where you can learn more about your mental health. You can be in a support group with others who share that experience. And just now more than ever, we need to be our brother's keeper. We need to be educated and look out for one another, so that while we're waiting to get into a provider or dealing with some of the challenges that we still face, we at least have that support from our community. So invite you to come, and again, just let's help spread the awareness on what mental health is.
Yeah, just being a friend can make such a difference. You talk about becoming educated on how to address these issues, be a friend. What's the most important thing we need to know?
Having a real conversation. When you see somebody struggling, reach out. Name what it is you've seen. If you notice a behavior change, talk to them about that. Find out what is motivating that behavior. Again, most people just need someone to listen. They just want to be heard and be able to verbalize what it is that they're dealing with. And again, that way you can support and maybe encourage them if it does seem like something that needs professional support, to again, reach out to the Warm Line, reach out to NAMI, and get that extra support as they're going through a difficult time. Moving
forward, what are future steps that need to be taken? Representative, let's start off with you. What are some other things you're working on?
Yeah, thank you. So we're continuing to expand mental health programs in schools. It's interesting that for decades we have screened for hearing and vision issues in school, but those things aren't the #1 cause of death for ages 10 to 24 in Utah. We've passed legislation that allows schools to do mental health screenings with written parental consent, and we've referred a lot of children to resources. We look forward to schools continuing to increase those, increasing our number of school counselors, and training parents and citizens of what to look for, how to have those respectful conversations, and then know what resources they can refer their friends and loved ones to when they find that there might be an issue.
All right, Taryn, one last message from you and your organization as we wrap up this segment.
You know, we're getting ready to launch 988. That goes live in July. That will now be the new National Suicide Prevention Lifeline number, so folks can easily access services by calling that 3-digit number. But just again, encourage people that if you see somebody struggling, reach out. If it's you, you know, there is help available. We want to support you. We want to connect you to the things that you need to get through the crisis. So please let us, you know, let us by telling somebody, and tell someone you trust, because we're here for you and we want you to live.
Yeah, very important. Thanks for bringing that up. Not yet, but coming soon, 988, just like an emergency 911 number, a very easy one to call and get everything you need right there. Really appreciate having both of you on. You're both great friends to the show, and this is a really important conversation. Thanks so much for being here.
Thanks,
Thank you.
Glenn.
Stay with us. We'll be right back with more Inside Utah Politics right after the break.